This video will walk through the IBM Knowledge Accelerator for Healthcare to give you an idea of its extensive business coverage. This top-level view shows the four main categories within the Knowledge Accelerator for Healthcare as follows. The Business Core Vocabulary, a comprehensive collection of healthcare-specific terminology organized in categories reflecting healthcare business areas. Business Performance Indicators, an extensive set of healthcare KPIs arranged in business-focused performance analysis groups. Business Scopes provide collections of business core terms that address particular healthcare use cases. And industry alignment vocabularies that include terms from data standards, reporting standards, and regulations that are typically externally published and used by healthcare organizations to ensure compliance. Let's start with the business core vocabulary. This area includes over 9,000 terms arranged in 49 main subcategories. We can see the first page of these subcategories, including accounting, allergy, and care management. I'll page through these, so now we see more, including diagnosis, encounter, and human resources, patient medication, personal health record, and point of care device, population, referral and authorization, and surgery. So this should give you an idea of the extensive business coverage in the Knowledge Accelerator for Healthcare. Let's go back to the first page and select Clinical Order. This lists the business terms that are relevant to the clinical order category. They include concept terms like patient or claim, as well as property terms that describe these concepts, like date of birth or claim number. We will select Clinical Finding. We see the term description and its primary category. This term also has several secondary categories listed as business scopes that I will describe later. Under Assigned From, we see terms in the industry alignment vocabularies that are assigned to this term. And under Related To, we see the relationships between this clinical finding term and many other terms. Scrolling down further, we see under related terms that clinical finding is not a type of anything, but that it has types. So, for example, device finding is a subtype of clinical finding. Continuing down, we see that clinical finding is classified as a concept term. Let's go back up to those related terms. And on the right, we see Has a Part Of. This lists the terms that are properties of clinical finding. I will expand the list and select Observation Method. Again, we see the term description and that its primary category is clinical order. Scrolling down, we see it has a number of assignments from terms in the industry alignment vocabularies. And further down, we see some illustrative examples that can be read in conjunction with the term description. At the bottom, we see that it is classified as a property. So let's go back to the initial view of the four main categories and select Business Performance Indicators. This area contains over 5,000 measure terms in over 240 performance analysis groups that are organized in 26 main subcategories. This lists the first page of these. So we can see categories such as claims, clinical analytics, consumerism, and HEDIS. On the next page, we see more, including operational performance, regulatory reporting, and service line analytics. And finally, underwriting and utilization management. I am selecting disease-specific measures to see the terms relevant to this category. I will type analysis into the search bar to focus on the performance analysis terms that group the measure terms. Selecting COPD analysis shows the description of this performance analysis term, which I can expand. This includes suggested dimensions or axes of analysis. Scrolling down, we see under Analyzed By the terms related to these axes of analysis and the categories they belong to. Then under Related Terms, has a part of, we see some of the measure terms that are associated with this performance analysis term. I will select pharmacotherapy management of COPD exacerbation. Now we see a description of this measure term, which we can expand or contract. And as we scroll down, we see the terms from which it is calculated and the formula. Further down, we see that it is part of COPD analysis, as we'd expect, but that it is also part of HEDIS effectiveness of care respiratory conditions analysis. Now, navigating back to our four main categories, we select industry alignment vocabularies. Each subcategory is an industry standard, regulation or dataset for healthcare, and they're typically externally published. We see familiar standards like CCD, HIPAA, HL7, and FHIR, which I will select. And I now drill down through the FHIR category structure to care plan. This lists the terms within this subcategory as originally published. I will select the term care plan. We see its description and its primary category. And we see that it is assigned to two of our business core terms. Scrolling down, we see that this term has a number of other terms listed under has a part of. And at the bottom, we see that it is classified as an alignment term, but also as a group term, explaining why it has those other terms, such as care plan period. So, navigating back to our four main categories once more, we select business scopes. Paging through these, we can see the wide range of business scopes provided. We can also see how some of the categories in business core terms may have multiple related scopes. There are more than 140 business scopes included in the Knowledge Accelerator for Healthcare, so I won't go through them all. I select Imaging and scroll down to see the concept terms that support the imaging use case. We can get a different view of this by selecting to explore relationships and then expand the terms. And that's the end of this walkthrough video. Thank you for watching.